everybody, it's Caitlin. Welcome back to my channel. And if you're new here, I'm really grateful that you would take a couple minutes out of your day to check out my channel. I really hope that you will consider subscribing down below. Make sure to press the little bell button. It'll make sure that you're totally updated whenever I post new things. And of course, little thumbs up, likeys are always super appreciated. Welcome, I'm Caitlin. Today, I thought that I would make a video about Sjogren's Syndrome. What the f is Sjogren's Syndrome? How do you spell that? How do you say it? Am I saying it right? The reason I wanted to talk about it today, because I was looking on my Facebook memories, and I got a little memory that 2 years ago I had my Sjogren's lip biopsy done. You know, I'm sure that if you have an autoimmune disease, you have heard of Sjogren's syndrome, or you have Sjogren's syndrome. A lot of times with autoimmune diseases, you could have one, but like have underlying conditions of other things. Like, I have SLE lupus, but I also have Raynaud's, which is a circulatory problem. So they're super common together. Another one that's super common to have would be the Sjogren's syndrome. So 2 years ago I had that biopsy done. So what had happened was I had switched rheumatologists. Couldn't have made a better decision. I ended up seeing like the top Sjogren's guy, as they call him. He was so great. I will actually link his video down below, Dr. Gayeth Noisa. He used to work with my medical center, but he actually just recently left the practice to go to another state to open up a Sjogren's clinic. So he is like super subspecialized in that. Great guy, super miss him. But whenever I saw him, I was explaining over my symptoms, and I had mentioned to him that they had thought that I had Sjogren's but never really tested for it. I mean, they had tested in my blood work, and I have all of the major symptoms, but no really major treatment, I guess. So what is Sjogren? It's an immune system disorder. It's characterized by dry mouth, dry eyes, dry skin, just overall dryness. It really stinks. I mean, you wouldn't think like, oh my gosh, that's so serious, but it's very uncomfortable. It can cause things like tooth decay because there's just not enough saliva in your mouth. It can cause cavities. It can cause bad breath, dry eyes. I am actually not even allowed to wear regular contacts right now. I actually can't see a thing. So if you see me like looking all over the place, it's because I don't have my glasses on, and I'm not very happy with my glasses when I'm on. You can have a special kind of contact made, which I did. That'll be another video, but and that specially treats the dry eye. So there's a couple different ways that you can test for Sjogren's. You could do a spit test. It's like a salivary flow test, where you spit into a tube essentially to see how much spit you've provided. I failed that test miserably. It didn't go well. That was like a red flag for Sjogren's for sure. You can also do an eye test. I'm not sure exactly what it's called for sure, but they put these, I guess it's little pieces of paper on your eyeballs for a few minutes, and they see how tear-filled it gets. I also failed that test miserably. Another red flag for Sjogren's. I've had some blood work done for it before as well. That all came back inconclusive every time I had the test done, so it was kind of like a yay or a nay kind of a thing. A couple years ago I did a 23andMe like ancestry health kit. It was actually, I got it for free. It was for a lupus research, and you spit in the tube and then you send it in. They test for that also in the saliva that you send. To be honest with you, I don't remember the result of that, but I want to say it was negative. The other test that they can do is a lip biopsy. Specifically, it's called a labial gland biopsy. So that's the gland that's right here. They're basically going to cut that out, send it to pathology, and get you some results. I'll just kind of walk you through my experience. I'm gonna put in some pictures so that you can kind of see a little bit about what the experience was. First and foremost, my rheumatologist specialist, he had sent me to a surgeon to have a consultation. I met with him, had like a quick 15-minute consultation. Honestly, I thought he was going to do it that same day, but No. They scheduled me back for surgery. It was actually scheduled in a hospital setting, so it was at an actual hospital in an operating room. They kind of make it out to be a little bit more serious than you should think it is, because it's really not that big of a deal. But you do have to go, you have to check in at the hospital. You have to go through the whole 9, you know, answer all the questions and everything like that. I wasn't being sedated, so there was no general anesthesia, nothing of that nature. It was all local anesthesia, which if you don't know, that's just when the doctor injects you with some lidocaine or something similar to numb the area that they'll be working in. So everybody was super, super nice. I did have to wear a beautiful hospital gown. And they put my hair into a net, you know, keep everything sterile, everything safe. Everybody was really, really nice. It was quick and time efficient. I drove myself. I didn't have anybody there with me. I didn't have a copay or anything like that, but of course check with your individual plan and policy if you're questioning that. Okay, so they wheeled me in. Well, the doctor of course asked me, you know, questions and stuff beforehand. They wheeled me into the operating room, and I'm laying flat down on this table. The nurses were so nice, really trying to keep me comfortable. I didn't have anything before, like no oral sedative or anything like that, no sedation, just numb, like I said. So I was a little bit nervous. I did feel a little bit of pain, but I'm thinking it was mostly just pressure, you know, and you're nervous and you kind of overreact a little bit. I kept calm, cool, collected. The nurses were amazing. They let me hold their hands. They said, squeeze, 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 you're gonna be okay. And the actual procedure took no time. He literally just made the incision, you know, took out what he needed to take out. I think he put in some stitches, but nothing major. I actually had no follow-up visit. They did not prescribe me any medications, no antibiotics, no pain medications, nothing of that nature. So I was numb for a couple of hours. So much, so my whole lip was swollen, and it was like white. It was like a super white, swollen lip. It's kind of funny. And then I put ice on it, you know, to help with the swelling. I followed all of my post-op instructions, but like I said, it was nothing major, nothing crazy, no post-op complications, but I would say that I am a slower healer, so it did take longer than I would hope for to be fully healed, but no infections or anything like that. It was quite painful for me. I never would want to have to do it again, but like I said, I'm a slow healer. I have a compromised immune system, so stuff like that for me is a little bit more traumatic. For the most part, ice and Tylenol, because I can't take Motrin, were very, very helpful in the healing stages. But so as far as that test came back, it was not supportive of Sjogren's. And it did somehow find a mild chronic infection in my salivary gland. Nothing major. The doctor didn't even talk to me about that because they were so focused on the Sjogren's that they didn't look at the other parts of the testing, I guess. But I'm assuming it's fine because I never heard anything back about it. Yeah, assuming. Wish me luck. But so it's been 2 years since I've had this done. So it still feels like, well, obviously scar tissue. So it feels like scar tissue in my mouth right here. Sometimes I feel it being more inflamed than others, but only because I have an inflammatory problem. And I find myself chewing on the scar tissue. Don't judge me. It's weird. I don't know why I do it. I can go ahead and show you the site. I don't know if you'll be able to see it very well, but it's just a little lump. Let me see if I can show it to you. So just right here. Right here. Yeah, nothing major. So how can you go about treating Sjogren's or symptoms? A lot of what you can do is purchase some over-the-counter items. So I use saline. In the morning and the night, you just squirt it in your nose. It's a little mist. It helps to moisten your nasal passage. It's just straight saline. Any brand will do. I find that helps. Even just sitting here talking, I need some of this. This is some Biotine Dry Mouth Moisturizing Spray. This you just spray in your mouth. It's very moisturizing. Biotine has lots of different products. There's this toothpaste, there's a mouthwash, there's a mouth rinse, which I'm not entirely sure what the difference is. I think one is just like moisturizing and the other one is actually like a mouthwash that moisturizes. They have little mints that you can buy. Those are amazing too. I keep a couple in my purse, in my pocket. Just pop one in. Those are really great. There's all kinds of different brands, so it doesn't necessarily have to be Biotin. There's all kinds of different options out there. Another important thing is eye drops. I got eye drops coming out the wazoo. I keep them in my purse, in my medicine cabinet, on my bedside, at my desk at work, in my car, everywhere. These are an absolute must-have. So I have like a lot of eye doctors. I even lost count. I think like 4 or 5 eye doctors. They all do different things. But they recommended that I use this brand, Refresh, Liquid Gel, or Celluvisic. Whichever one you can get your hands on, this is the best brand, most highly recommended. I put eye drops in my mouth, in my eyes constantly. It's very, very lubricating. It's best if you get like a preservative-free one. So like those are like the little tube, single-use tubes. But I use them so often. I just go big. I'm gonna offer like a friendly tip here. You're probably not going to want to put in the eye drops and this at the same time. My tear ducts are like wide open. I mean, everything just flows right down. So it's like flooding, I call it flooding my system whenever I do the nose spray and then eye drops also. And it just kind of has like a post-nasal drip type feeling. Yucky. But I just wanted to share with you my Sjogren's experience, and I hope that it helps somebody out there. And like I said, I will link down below my actual doctor giving a speech and educational experience about Sjogren's. So make sure to watch that because he's awesome. I miss him so much. Such a great doctor. I will see you back for my next video. Thanks so much, everybody. I hope you're having a great day.